Hi, my name's Katie. I'm one of the midwives that works here in Corby. I'm just making this little video to explain to you what's going to happen with the postnatal visits once you come home after you've had your baby. So the hospital will let us know that you've been discharged from the hospital. We do 3 routine visits. The following day after discharge from the hospital, you'll visit on day 5 where we will weigh the baby and do the routine blood test, and your day 10 visit, which is a discharge visit, all being well. So what will happen with your first day home is that we will call you. This will be to assess and make sure that yourself and your partner and any family members are feeling well. If you are feeling well and everything is going according to plan and you have no worries or concerns, we're happy to do this over the phone and not do a home visit. If we feel that you're having any problems or with feeding or you have more concerns than we can help you with over the phone, then we will come and do a visit in your home. The day 5 visit will always be a home visit by a midwife at the moment, where we will weigh your baby and do the routine blood test. It's very important that you know that when midwives come to your home, they will be in full protective equipment. So this means the midwife will be wearing a mask, gloves and an apron for all of the visits. So please don't let this alarm you. Your day 10 visit routinely will be done over the phone at this point. If your baby has had any concerns with weight loss and we feel we need to weigh your baby again at that point, we will come to your home. But otherwise we will be just doing this over the phone, and then the health visitor will attend your home between days 10 and 14. We will come and see you if you're having extreme feeding problems, and if your baby needs to be weighing on day 7, this is an essential visit that we have to do. So again, we will come to your home for that. There are options for you to come to us if you are concerned about having health professionals in your home. We can arrange for you to come to our clinics to have your baby weighed and to do those visits with you here. So if that is something that you would prefer to do, then please just let us know and we can do that for you. Our telephone number in our office is, so if at any time you're having any concerns and you'd like to call for more advice, please feel free to do so. Thank you. So during the postnatal period, there are lots of different questions that we ask so that we're able to assess the well-being of mums and babies. So with regards to mums, we will always ask about the bleeding that you're having and make sure that this is not excessive. If at any point you feel this is excessive, please do let us know so that we can assess it. You can also call labour ward if you feel it's excessive, so that they can assess and make sure that everything is okay. It's very important that we're looking for signs of deep vein thrombosis after having a baby. So if you developed any real shortness of breath or any chest tightness or chest pain, it would be very important that you seek medical advice for this one. As with the legs, you would notice that one of your legs often would get a lot more swollen than the other. It would be very painful, very hot to touch and very red to look at. This again requires medical advice. If you develop any headaches or visual disturbances, and these visual disturbances can come in the form of flashing lights, black wiggly worms in the front of your eyes, any blurred vision, it's very important that you let us know so that we can check your blood pressure and do further investigations to make sure that nothing untoward is going on. Signs of infection that we're looking out for would be a fever. If you have a cesarean wound, often signs of infection are that it's looking a little bit swollen, quite red and angry to look at, and often the skin around it would be quite hot to touch. You would notice that there would be some discharge oozing from the cesarean wound. This is not just the cesarean wound, but also if you have stitches vaginally in the perineum. If you notice any offensive smells, these are all signs of infection, and we can do swabs to make sure that see if there are anything that we need to treat for you, so please do let us know. Very important that you have some pain medication available at home after you've had your baby, just in case this is needed. It's very common for babies to get sticky eyes in the first few days after delivery. The best advice that we can give at this point is to bathe every few hours with cool boiled water and cotton wool, and this would be done by making sure that the cotton wool starts at the inside of the eye and wiping outwards once, and then discarding that piece of cotton wool and repeating if you feel it's necessary. Please don't feel like you need to do this every hour. 3 or 4 times a day at this point is enough, and that's usually enough to get rid of any sticky eyes. If it continues after 2 or 3 days of bathing your baby's eyes like this, or it's getting worse rather than better, you may find that you need to see a GP for medication. We will also assess the output of your baby, which means we'll be assessing how many wet nappies and how many dirty nappies, and the colour of the stools of your baby. So on day 1 we would expect maybe 1 to 2 wet nappies and 1 to 2 dirty nappies. The wet nappies would be quite empty, they wouldn't be heavy with urine, and the nappies would be a black sticky colour. By day 5 we would be expecting that your baby was having at least 5 or 6 wet nappies, and these would be quite full and heavy with urine at this point. And for the majority of babies they will do at least 2 poos a day, and these will be a yellow colour, often with small seedy bits in it to see as well, and this is very, very normal. Breastfed babies' stools will be much more runny than those that are bottle feeding, which is also very normal. If you notice that your baby is looking pale, blue or floppy at any time, this is an emergency and you need to call an ambulance in this case. With regards to cord care, the advice is that you try and keep it tucked out of your nappy at any time, and that it's clean and it's dry. If it's looking sticky or it's got a very offensive smell to it, we would often take a swab to make sure that there are no infections developing. And if you do bath your baby before the cord has fallen off, please make sure that you just dry it really well afterwards. We will be assessing baby's colour, changes to the face and often the whites of the eyes. Do please let us know, because there are tests that we can do to make sure this is okay. We would recommend that babies feed at least 8 times within a 24-hour period, particularly for breastfed babies. This would be a minimum. Most babies will feed much more than that while they're breastfeeding, and we don't get so stuck on the amount of hours in between these, but at least 8 feeds within a whole 24-hour period is what we would expect. Thank you.